Hi, fellow future RNs. Today, let's talk about stroke. Okay, stroke is also known as your CVA or your cerebrovascular accident, or in some sources or sa other hospitals, ang tawag dyan ay brain attack. Stroke manifests as a sudden focal neurological deficit and is caused by cerebrovascular disease. Okay, so pag nagkakaroon ng stroke ang tao, part of the brain cannot get the blood and oxygen it needs that will cause the brain cells to die. Okay, remember that cerebral anoxia or yung condition wherein ang ating brain ay hindi nasusuplayan ng oxygen, ng very much needed na oxygen. That's your cerebral anoxia. Lasting longer than 10 minutes can cause cerebral infarction with irreversible change. So, ibig sabihin kapag nagkaroon na ng damage yung brain, kapag yung cerebral anoxia ay mas tumagal pa kaysa sa 10 minutes, yung mga changes no or yung damages na pwedeng mangyari, hindi mo na yan mababalik. It's irreversible. Kaya nga ba, it's important na once nag-show ng symptoms ng stroke, agad na madala ang ating patient sa hospital or agad mabigyan ng lunas or matreat ang patient. Okay. Ang causes ng stroke, no? So we have thrombosis, embolism, and hemorrhage from rupture of a vessel. Okay. So ang thrombosis ay blood clot. Okay, alam na natin yan. It's a blood clot. Kapag embolism, yan ay clot na na-dislodged. So sumama siya sa blood, no? For example, ito ang yung artery or yung ugat. So kapag ang clot diyan nag-form, no, sa artery nandiyan, that's your thrombus. Okay, that's a blood clot. So kapag yan ang bumara doon sa brain mo, kuwari doon sa mismong artery sa iyong brain, doon nag-form ang clot, that's thrombosis. Pero kapag itong clot na to galing sa ibang part ng body, tapos sumama siya sa blood flow, na-dislodge siya dyan, tapos sumama siya sa blood flow, tapos napunta siya doon sa iyong brain, yan ay yung embolus or embolism naman yan. So itong dalawang to ay under yan sa isang type ng ating stroke, which is your ischemic stroke. Later malalaman natin. And another cause is the hemorrhage from a rupture of a vessel. Yung kumari nag-burst ang iyong artery. Okay. For the risk factors, we have atherosclerosis, that's thickening or hardening of the arteries kasi merong mga build up ng plaque, ng mga fats dyan. So, nagnanarrow yung daanan ng ating blood. So, hypertension, kasi pag mataas na mataas yung pressure sa ating ugat na pwedeng mag-burst ang ating arteries. Anticoagulation therapy kasi prone sila sa bleeding. ADM, of course, stress, obesity, and oral contraceptives. So, that's for causes and risk factors. Okay, so generally may dalawang type ng ating stroke. Yung ischemic, nabanggit natin kanina, and hemorrhagic. So sa ischemic, under dyan yung embolism and yung thrombus. So sa ischemic, ang nangyayari, nagkakaroon ng obstruction, di ba? Ang blood hindi makadaloy. No? And our brain needs our blood. Yan ang food niya. Kailangan niya ng oxygen and glucose. So yung part na yan dyan na merong obstruction, hindi siya nakaka-receive ng blood. Kaya siya nagkakaroon ng ischemia. Okay, kaya siya ischemic stroke. Kapag naman hemorrhagic stroke, ang nangyayari ay meron kang arteries na nagra-rupture. Nagbi-bleed ang part na yan ng brain. So, mga pwedeng mag-cause ng bleeding sa brain is, kunwari, yun na nga, nabanggit natin kanina na nagkakaroon ng mga yung mga patients na merong or under antithrombolytic therapy. So, pwede silang mag-bleed. Cerebral aneurysm also, kapag nag-rupture yan, magbi-bleed yan. Hypertension, again, nabanggit natin kanina. Yung trauma, of course, and malformation sa ating arteries. So, both of this condition, yung ischemic at hemorrhagic, kunwari, nagkaroon ng blood clot dyan or nagkaroon ng hemorrhage anywhere in the brain, magkukos yan ng cerebral hypoperfusion. So, ibig sabihin, nagdi-decrease no, ang perfusion doon sa part na yan ng brain. And kapag nangyari yan, kapag yung part na yan ng brain is hindi makareceive ng blood, ng oxygen, ng glucose na kailangan ng brain, no? Yan ang food ng ating brain. Pwedeng mag-increase ang ating lactate. Kasi 'di ba ang ating body nagpo-produce ng lactate, no, kapag nade-deprive ang ating tissues sa oxygen. So, pwedeng magkaroon ng lactate acidosis. That could lead to inflammation, kaya nag-i-inflame, no? And also, kapag nagtagal na hindi makareceive yung part na yan ng brain, ng blood, ng oxygen, ng glucose, mamamatay, magkakaroon ng necrosis, mamamatay ang brain cells na yan. Okay? So that's what happens kapag meron tayong stroke. Okay, so isa sa mga madaling tandaan na assessment, no, how to assess a patient or a person ma-manifest, no, ng symptoms ng stroke is yung ating mnemonics na be fast. So B is for balance. So kapag nawawala ng balance ang ating patient, may headache or may dizziness. E is for eyes, nagkakaroon sila ng blurred vision. F is for face, one side of the face is nagdo-droop, no? Face drooping. A is for arms, arm or leg weakness. So yan yung pinapaangat natin yung kamay ng ating patient kung kaya niyang ma-sustain, no? Ma-hold yung ganyang position. So usually yung other side, yun yung weak kapag may stroke. So next, S is for speech difficulty, yung slurred ang speech. E is for time because time is very important. Time is of the essence kapag stroke, no, ang ating patient. Kasi kanina nabanggit na natin na kapag nagkaroon ng cerebral anoxia for more than 10 minutes, ang mga changes can be irreversible. Okay? So another thing about T na time is important na i-note natin yung time kung kailan nag-start na mag-manifest, no, sa ating patient ang signs and symptoms ng stroke. Okay, other assessment findings na pwede natin makita sa patient na may stroke is pwede silang magkaroon ng agnosia or the inability to recognize familiar objects or persons. Pwedeng magkaroon ng apraxia, yun naman yung loss of ability to execute or carry out skilled movements or gestures. Pwedeng magkaroon ng hemianopsia, which is the blindness in half of the visual field, and also your homonymous hemianopsia, or yung loss of half of the field of view on the same side in both eyes. Next is the neglect syndrome, or client is unaware of the existence of the paralyzed side. Like, kunwari, ang patient natin merong left-sided paralysis, no? After niya ma-stroke. So, kunwari, nag-shave ang patient mo, yung sinashave lang niya yung right side ng face, ganon. Yan yung mga isa sa mga examples ng neglect syndrome. So, kasi paralyzed yung part na yan ng body, hindi na-feel ng patient. So, nineglect siya. So, hindi nagiging unaware yung ating patient doon sa side na yun ng kanyang body. Okay? And pwede rin magkaroon ng mga proprioception alterations, which is the altered position sense that places the client at increased risk of injury. So, other things to remember, na, di ba, during our anatomy and physiology, nalaman natin na the right side of our brain is responsible sa movement on the left side of our body. Di ba, nagko-cross sila, right side of the brain to the left side of the body, and then the left side of the brain, siya naman yung responsible sa functions or sa movement ng ating right side of the body. Kaya, kapag ang na-damage na or nagkaroon ng stroke, no, sa right side ng brain ng ating patient, ang affected or ang possible na pwedeng magkaroon ng paralysis is the left side. Okay? And same thing kapag naman sa left side yung stroke nangyari at left side of the brain ang na-damage, ang paralysis naman niya na pwede mong makita is sa right side of the body. Pwedeng the same ang manifestations ng ischemic at hemorrhagic stroke. But the thing is, ang kanilang treatment ay magkaiba. That's why identification of the type of stroke occurring is critical in determining the appropriate treatment. That is why one of our priorities is to perform or masend ang ating patient sa CT scan. Yan usually ginagawa na imaging procedure para makita kung anong klase ng stroke meron ng ating patient. Is it a ischemic stroke or a hemorrhagic stroke? Kasi nga, again, magkaiba sila ng treatment. So ito yung treatment, medical treatment na binibigay no kapag merong stroke ang ating patient. Kapag ischemic, again, ito yung merong kang clot sa ugat doon sa part ng brain. Okay. Ang isa sa mga binibigay is your thrombolytics, or these are your clot busters. Okay, nagtutunaw ng clot, no, para kapag natunaw na yung clot, aayos ulit yung blood flow doon sa part ng brain. So examples yan is your urokinase and streptokinase. Isa pang pwedeng ibigay is your TPA. Your TPA is your tissue plasminogen activator. Okay, magtutunaw din siya ng clot, no, like your thrombolytics. Ang mga examples naman niya is your alteplase, reteplase. The thing about sa TPA is meron siyang window period. Okay, which is 3 to 4.5 hours. Ano ba tong window period? So, ang TPA pwedeng magamit na treatment sa ischemic stroke kung yung manifestations ay nangyari, no, or nag-show sa patient within your 3 to 4.5 hours na window period. So kapag lumagpas dyan, hindi mo na pwedeng gamitin ang TPA. Okay? Kapag naman sa hemorrhagic na stroke, ang number 1 na medical treatment is surgery and other pharmacologic interventions. Moving on to nursing considerations. Okay, during the acute phase, Mga important things to remember. Okay, first, we maintain a patent airway and administer oxygen as prescribed. Okay. Next, we monitor vital signs. We position the client on the side to prevent aspiration, of course, with the head of the bed elevated 15 to 30 degrees as prescribed. Kasi kung naka-flat naman ng ating patient, baka tumaas ang kanyang ICP or intracranial pressure. Insert urinary catheter as prescribed and maintain a quiet environment. Important din na mag-monitor tayo ng symptoms for increased ICP. Kasi ang ating patient ay pwedeng at risk during the first 72 hours following a stroke. Or post-acute phase, place anti-embolism stockings on the client. Yan yung stockings na white na mahigpit. So, syempre, in-order niya ng doctor. And remove daily to check the skin. Okay? Nire-remove siya daily para i-check ang skin. Second, we monitor the gag reflex and ability to swallow. Kasi kapag may na-paralyze sa part na yun ng ating patient, pwede silang mag-aspirate. Thickened fluids yung binibigay natin rather than thin liquids. Kasi kapag thickened, mas pwede pang maubo no, ng ating patient. Kapag thin, tapos nilunok ng patient mo, pwedeng magdire-diretso yan, mag-aspirate yan sa lungs. Dahil pwedeng mag-aspirate ang ating patient, no, when the client is eating, position the client sitting in a chair or sitting up in a bed. And place the food in the back of the mouth on the unaffected side to prevent trapping of food in the affected cheek. Other important interventions sa chronic phase naman ng stroke. For example, merong neglect syndrome. Ang ating patient, we teach the patient to touch and use both sides of the body kahit paralyzed yung kabila para maging aware pa din siya no, na nag-exist yung part na yun kahit hindi niya nafe-feel. And also another priority is the safety of our patient. Lalo na kung merong mga vision changes, may hemianopsia. We encourage the client to turn the head to scan the complete range of vision kasi nga meron siyang blindness sa half of the visual field. So that's it for stroke. I hope you learned something today. Thank you, bye!